Hi all. So let us discuss the concept of the Monro-Kellie Doctrine in head trauma. You know, the brain it has the layers around it, and the cranium it is a rigid box in which the brain is situated. So what if there is a trauma or injury to the brain or to the head? Yes, when there is a trauma or injury, it results in hematoma, and also there can be brain swelling. When there is a swelling, it can compensate up to a limit because the venous blood and the CSF, like we can draw this as when we connect here a pipe, like there will be an exclusion of the venous blood or the CSF, and up to a limit it can compensate it, and also there will be an increase in the intracranial pressure. After that limit, further it cannot compensate and leads to herniation. So this is the concept of the Monro-Kellie doctrine. That is, normally the brain, when there is an injury, there can be a swelling. It can compensate by exclusion of the venous blood or the CSF, and there will be an increase in the intracranial pressure. But later on, further stages, it leads to herniation. So this is the graphical representation. You can see here it can compensate it. Further on there is a point of decompensation, and later it leads to brain herniation. The intracranial pressure is increasing, by which here also the size of the lesion is also increasing. This is a graphical representation. Yes, so I told you when it is severe it leads to brain herniation. There can be subfalcine herniation, that is, the cingulate gyrus is herniating under the falx cerebri, and also there can be a midline shift, and there is uncal herniation, that is the temporal lobe is herniating over the tentorium cerebelli, and it can compress the third nerve, that is oculomotor nerve. There can be central herniation, and also the most important, there can be tonsillar herniation, that is the brainstem. It can compress the major respiratory centers. Yes, there is some interesting phenomenon here called the Cushing's reflex or the Cushing's triad. I hope you have heard about it. Now, coming to the Cushing's triad. When I say Cushing's triad, I can directly write bradycardia, hypertension, and irregular respiration. Now, I will explain how it comes. We know cerebral perfusion pressure is equal to mean arterial pressure minus intracranial pressure. I told you when there is head injury, there is a rising intracranial pressure. So, I must always keep the cerebral perfusion pressure constant. In order to keep this constant, when there is a rising intracranial pressure, the mean arterial pressure it must be increased. So, when I want to increase the mean arterial pressure, I must try to increase the systolic blood pressure. So, I am trying to increase the systolic blood pressure. What must be done? The cardiac output must be increased. And you know, cardiac output is equal to heart rate into stroke volume. You see, if I try to increase the heart rate, the heart will be beating so faster. That means the proper filling of the heart won't be occurring. I cannot increase the systolic blood pressure here. So, increasing the heart rate is not a choice. What if I try to increase the stroke volume? Yes, that's a choice. That means I must try to increase the end diastolic volume. And when I try to increase the end diastolic volume, there is Starling's law. What is Starling's law? When there is an increase in the end diastolic volume, that means when there is more the heart is filling, the more force of contraction will be coming. And yes, I can increase the end diastolic volume, the heart will be beating more forcefully. At the same time, the diastolic interval, it shall increase. And what will happen? The heart rate will be decreased. The heart rate will decrease, but at the same time, I can increase the systolic blood pressure, mean arterial pressure. So I have derived it. The heart rate is decreasing, that is bradycardia. The blood pressure is increasing, that is hypertension, and also we will be having irregular respiration. So yes, this is how the Cushing's reflex or the Cushing's triad is occurring. Thank you. I hope you understood.